Let me ask you a question. By show of hands, how many of you have ever gone to an appointment with a doctor you've never met before? That's a lot of hands. That's a very common experience. I want you to imagine it. You sit in a room, you wait for the doctor to arrive, and when they do, you explain your symptoms, and they respond. This dynamic between you and the physician is fraught with issues of communication. Will you get the care that you need? Will the physician know what to do? Who holds the power in that room? Oftentimes, the power dynamic is a hierarchy. The physician holds all of the power and knowledge and dispenses it to the patient. We can think of this communication style as talking at. And for many medical conditions, this is enough. If you go in with a broken arm or pneumonia, this will probably be effective. However, my research is with people whose symptoms are not as visual or straightforward as a broken arm and not as well known as pneumonia. They have myalgic encephalomyelitis, also called ME, a chronic neurological disease which includes post-exertional neuroimmune exhaustion, orthostatic tachycardia, unrefreshing sleep, and pain. Because so many different organ systems are involved, physicians and patients need to work together to connect the dots, and the talking at model doesn't work here. When medical professionals are trained to streamline appointments by talking at, people with ME don't receive the care that they need. Here are some of their experiences. They told me, "I don't know how to convince my doctors to help me. My life matters to me the way that theirs does to them." One doctor told a woman with ME that she would be better off dead. They told me the doctor has no incentive to help me in the ways that I needed. These patients, including 2 with medical training themselves, were bringing everything they could to the table. They told me, when you're dealing with an illness like this that's so poorly understood and difficult to navigate, you need to stick with the doctors who believe you, advocate for you, and are in your corner. One woman with ME went to 41 doctors before she found one who was willing to engage with her as equal collaborators, both of them bringing essential knowledge to the conversation. We can think of this communication model as talking with. Across my research, people with ME described the characteristics of effective physicians who were able to help them and meet their needs by talking with. The first characteristic is belief. Effective physicians believe the patient, take their report seriously, and respect the patient's knowledge of their own bodies. Effective physicians believe the science that tells us ME is a physical disease, not caused psychosomatically. Second, willingness. Effective physicians said things like, "I will treat you. I will refer you to a specialist. I will do further research, and I will follow up with you online." The third characteristic is engagement. Effective physicians actually did the things they said they were willing to do. They actively listened to patients, they asked questions, they did examinations, and they developed a plan of action. Now, this might sound like a basic job description for a physician, but medical practice continues to prioritize talking at, and patients continue to experience harm. Physicians and patients, by talking back and forth with each other, you can take back the doctor's appointment. I imagine a healthcare system built from the foundations of talking with, infused with reciprocity and respect. This type of work is starting to take hold in some areas of the profession, but not quickly enough. Until we get there, I'll spend my time talking back. Thank you.